Today, Monday the 29th September 2025, is a special day for us at the Center for Primary Care Research as we join the Zambian Society for Hypertension to commemorate the World Heart Day 2025. This year's theme is Don't Miss a Beat. This theme serves as a compelling reminder for us to stay proactive about heart health through regular checkups, promoting healthy habits, and at the same time promoting quality health care for those who may be affected by heart diseases. Cardiovascular diseases remain the leading cause of death and disease worldwide. Most of the risk factors for these cardiovascular diseases are dependent on lifestyle, and that is why this call is urgent, because we know that once we take care of most of these lifestyle risk factors, we should be able to promote heart health for a majority of our people. The World Heart Day provides us a platform where we can interact with the public, instigate thought about heart health, and at the same time promote health-seeking habits about the heart. More so about hypertension, which is the leading cause of cardiovascular disease in Zambia. In 2025, we would really want to remind the public to take special care of their hearts. And we must take every opportunity to make it important to the healthcare workers to prioritize healthcare for the heart. While we would want to urge the public to do those things which promote healthy hearts, such as eating well, meaning we eat food that has very little salt, and we keep away from fatty foods, especially manufactured fats. We also want to encourage the public to walk a bit more, do a little more exercise. We would want to remind them to eat well. In eating well, we are saying, can we eat more vegetables than meat? Okay? We need to promote the eating of vegetables especially, but also putting on an amount of fruit. We need to get people to seek healthcare whenever they find an opportunity to do so. You don't have to go to the hospital because you are ill. You have to go to the hospital just to make sure that your numbers are correct, especially when it comes to blood pressure and sugar disease. These are well-known silent killers in that they don't have many symptoms to them, and yet they are serious illnesses. We would also want to get to our healthcare workers, our doctors, our pharmacists, our nurses, our biomedical scientists, our physiotherapists, that today is a day in which we ought to reach out to the general public about heart health. We ought to tell them what it is to keep their hearts healthy, and we ought to do those things which will make sure that their hearts remain healthy for a longer period of time, especially for those who already have issues with their hearts. Later this evening, we will be hosting a webinar targeted especially for the health workers. And in our webinar, we are addressing the issue of heart disease in Zambia. And so the theme of our webinar this evening will be accelerating prevention and control of heart disease in Zambia, trying to give it the urgency that is required, but at the same time insisting on what the health workers, the Ministry of Health, and the government ought to do for its citizens to ensure healthy hearts for 2025 and beyond. So you may join us. I think the link has been sent to most of the links for the health workers. And we are hoping to see you at 6 p.m. this evening on our webinar. Thank you very much, and have a day full of activities that will promote heart health. From the Center for Primary Care Research and the Zambian Society for Hypertension, we wish you well as you commemorate this very, very important day on the global health timetable. Thank you very much.